This website makes learning so easy. I found all my resources here.
This 3D visualization shows CCl2F2 particles traversing the nasal neuroepithelium, moving directly toward the brain and bypassing systemic circulation. The olfactory nerve pathway. The compound moves through the extracellular paraneural space surrounding the olfactory nerve bundles CNI. The trigeminal nerve pathway is shown originating deep within the nasal cavity, bypassing the cerebral cortex as we follow it posteriorly toward the brainstem. The rectal mucosa is highly vascularized. The superior hemorrhoidal vein drains directly into the portal vein, whereas the middle and inferior hemorrhoidal retrograde optic nerve sheath migration and brainstem anesthesia. While direct ocular contact with CCl2F2 is classically associated with local tissue injury, under conditions of high-pressure ocular exposure or accidental orbital puncture, the pressurized gas or liquefied halocarbon can penetrate the thin dural sheath of the optic nerve. The primary anatomical interface between the air-filled middle ear and the fluid-filled inner ear is the round window membrane. The green particles illustrate the movement of the inflammatory chemicals from the inner ear through the conduit and towards the brainstem, leading to meningitis. Once CCl2F2 achieves sufficient concentrations within the central nervous system and the cardiovascular system, it initiates a sequence of biochemical The underlying molecular mechanism involves a multi-channel blockade by the lipophilic halocarbon. Sodium channel inhibition. The compound suppresses fast cardiac sodium channels.
The underlying molecular mechanism involves a multi-channel blockade by the lipophilic halocarbon. Intracellular calcium.
CCl2F2 exposure manifests as a complex multi-system syndrome, presenting distinct clinical entities depending on the primary route of translocation. Understanding these clinical warning signs is crucial for identifying sudden inhalant-related cardiac events before they escalate.
As the surge hits the SA node, the heart reacts instantly. This rapid, forceful beating demonstrates the intense impact of adrenaline on the myocardium.
Translocation of CCl2F2 via the spinal, ocular, or auditory routes directly into the subarachnoid space induces acute, sterile chemical meningitis and severe
I can't seem to remember the exact dates of the treatments. It's frustrating.
I understand. Take your time. Perhaps tell me about the side effects you experienced first.
The CCl2F2 translocates across the round window membrane, disrupting the inner ear fluid and causing rotational nystagmus and tinnitus.
simulation shows cryogenic burn on the cornea. Note the retrograde pathway along the optic nerve, leading to severe retinal ischemia.
Vitals are dropping. Give me the epi. Right here, doctor. Pushing now. Watch the pressure. Watch the pressure.
Still in VFib. Continue compressions.
Epinephrine 1 milligram now.
1 milligram pushed.
Continue compressions.
Epinephrine is held per protocol.
Switching now. Maintain the rhythm.
Given the patient's unstable rhythm, we need to initiate the antiarrhythmic infusion now. Should we also consider optimizing the potassium levels first?
Alternative antiarrhythmics for ventricular fibrillation or pulseless ventricular tachycardia refractory to defibrillation, class 3 antiarrhythmics such as amiodarone should be administered.
Reltormaxate. Magnesium sulfate. Administered as a 2 grams IV bolus over 1 to 2 minutes, magnesium stabilizes the myocardial cell membrane. Sodium bicarbonate. Severe CCl2 toxicity often triggers profound metabolic acidosis. Acidemia further sensitizes the myocardium and worsens CNS depression. Corticosteroids cauries. To combat the severe inflammatory response of chemical meningitis, high-dose intravenous dexamethasone, 10 mg.
The pathology of papilledema necessitates this fenestration procedure, which is crucial in preventing irreversible retinal ganglion cell loss.
Modern clinical toxicology utilizes advanced biotechnical interfaces to continuously monitor, analyze, and automate the treatment of patients. Non-dispersive infrared sensors. NDIR sensors represent the gold standard for real-time optical detection of freon gases. Semiconductor gas sensors. These flat-surfaced metal oxide semiconductor sensors operate on the principle of variable electrical conductivity.
Volatiles are partitioned into the gaseous headspace of a sealed vial at a controlled inlet temperature, injected onto a capillary column, and analyzed using mass spectrometry.
The ICP is spiking and the RSO2 is dropping. We need to intervene now. Start cooling measures and prep for a drain.
All right, I'm going to check the stiffness in your neck now. Let me know if this causes any pain. We will move slowly.
Keep a close eye on the ICP trend over the next hour.
Understood, doctor. I'll alert you to any changes.
The green particles illustrate a toxic compound traversing the tympano-cochlear aqueduct axis. Their accumulation at the brainstem directly leads to CNS depression.
Systemically, CCl2F2 accumulates within lipid-rich neuronal membranes and cardiac tissues, altering GABA dynamics.
Let's move. Get me the airway kit and start fluids wide open.
Airway kit incoming, fluids started.
Finally, the integration of advanced biotechnical interfaces such as real-time NDIR optical gas sensors, EEG-guided closed-loop drug delivery systems,
This website makes learning so easy. I found all my resources here.